Good afternoon, Child Welfare. I'm coming to you today to have a quick dialogue in response to the public health email about the Delta variant of COVID 19 and where we are at with practice. First and foremost, I wanted to say again that the safety of all of our staff and the families that we work with is paramount and is still very much in the forefront of decisions that are being made, and that is not any different in regards to the information that I'm about to share. As the email stated, the Delta variant is spreading within our community. It appears to be spreading quicker than any other communities in Colorado. And so just wanted a quick reminder on a few things and to discuss any issues that may be coming out of the state in regards to our practice and how we are going to handle those issues. First and foremost, PPE is still strongly encouraged, although not mandated. Masks are available, goggles are available, face shields are still available, and we are still strongly encouraging face-to-face visits to be held outside and still maintaining 6 to 10 feet of social distance. Understanding that when assessing for safety of children, if you've got to go in to homes, that is certainly part of our job and understandable to accurately assess the safety of children. We still need to be doing those assessments face-to-face, and that situation or practice has not changed. In regards to an operational memo that the state has recently sent out, where they are wanting our PRMs to be back into homes unless there's a direct concern or a direct quarantine that is medically driven due to COVID. Certainly inside Mesa County, I believe we have been operating that way for a while. We are face-to-face unless there is a COVID concern, and we are not going to change that practice at this point. Our face-to-face with children are also primarily being done face-to-face within the county unless there is a concern that we can document about COVID, and that is not going to change. What I am going to ask you guys to do is, if you feel that there is a COVID concern due to symptoms and we don't have a positive test, and we don't have a medical quarantine at this point, but you are very concerned that there is COVID inside the home, please ensure that if you are going to do a video conference that you are documenting why, and that we are going to add that in Mesa County that the Delta variant has been identified by our public health department as having widespread community transmission. Now I'm going to be sending out an email with that language that you can use and just copy and paste into your Rock Notes. But I just want everybody to understand that leadership here in Mesa County is support of that kind of work, that if you don't have a concern of COVID directly into a home, we should still be doing face-to-face visits. If you do have a concern, you are able to use video conferencing to meet your face-to-face requirements as long as you don't have any safety concerns and it doesn't meet any of the criteria that we had prior in regards to going seeing kids face-to-face. So safety plans, immediate return homes, placement disruptions, concerns of abuse and neglect in foster homes, things like that, that should still be met with a face-to-face meeting, albeit with proper PPE if you choose to do so, and with some social distancing and outside interviews. As far as our out-of-county travel, we are not going to change our process at this time. You are still able to travel if you have not seen your child or youth in a 3 or 4 month period, but you are still able to do video conferencing as long as you feel that the child's safety is ensured and that we can document that that safety is ensured. Again, we are going to still document in trails that the community-wide spread of the Delta variant is going on here in Mesa County, and in order to do our part without transmitting to other counties, we are still able to use the video conference option. I've been in touch with the Department of Human Services Child Welfare Director in regards to this issue that appears to be specific in Mesa County, and he supports as long as we document it and that we can ensure children and youth safety and foster home safety. He understands that we have to do what we have to do. So I just wanted to get that information out to you all. Again, I will be sending an email that you can use the language in regards to the community-wide transmission of the Delta variant if you choose to use video conferencing. But once again, we should be still meeting our families face-to-face if we have no COVID concern, and using the video conference only if we have a concern that's directly related to the home that you're going to. If you have any questions or concerns, please reach out to me directly. I will do my best to answer any questions or concerns that you may have in a very timely fashion. Thanks for all you do, and thanks for all of your patience once again with all the different information around COVID and how that's impacting our practice. Hope everybody has a great rest of your day, and we'll see you around the corner. Bye-bye.